Former healthcare workers tell me hospitals need more staffing and better trained security. I found that law enforcement officers are getting called to stop an assault or quell a disturbance at hospitals across our 5 counties about 3 times every day. In the worst cases, these attacks change victims' lives forever. A double amputee Army veteran shoots a doctor and a fellow vet at the West Palm Beach VA in 2019. He's later convicted on federal charges after prosecutors say he smuggled a gun in his wheelchair. A knife-wielding woman arrested in 2023 is awaiting trial after deputies say she stabbed 3 nurses and tried to abduct a child from a neonatal unit at HCA Palms West Hospital. A Baker Act patient charged with attacking nurse Leilama Lal in February, leaving Lal severely injured and nearly blind, also at HCA Palms West. Dr. Cindy Joseph is Leilama Lal's daughter.
It's not just her, it's a systemic problem, throughout the healthcare community, and, things need to change.
I reviewed records from a dozen law enforcement agencies, and I found assaults and disturbances at hospitals are common.
I've been kicked, I've been spat at, I've had people throw punches. You're verbally abused every day.
Linda Stewart worked as a nurse at 2 hospitals in Palm Beach County. She retired in 2021.
Over the course of the 25 years that I worked, it became progressively worse.
Why do you think that is?
Well, I think society is devolving.
Stewart experienced her first workplace scare about 10 years ago when she says a patient left his room and confronted her.
And his hands started going towards my throat. That's how close he was to me. And I'm calling help, 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 and nobody can hear me.
Luckily, she says she heard the ding of an elevator and a doctor stepped in.
And he put him up against a wall. Well, I called security.
I analyzed data from 16 area hospitals and uncovered that officers responded more than 5,000 times in the last 5 years for assaults and disturbances. When I took a closer look, specifically at assaults, I found the numbers spiked in 2021 at the height of the COVID pandemic. Then last year, it reached a 5-year high with 260 assaults at area hospitals.
We certainly have seen it for years in the emergency department, but it has spread throughout the hospital setting.
Mary Mayhew is the head of the Florida Hospital Association. It represents more than 350 medical centers throughout the state. Mayhew says hospitals are placing workplace safety front and center.
I have seen a sea change across the state with the number of hospitals now having metal detectors and security entrances. They're closing down other entrances to their building to create that secure environment.
When I asked HCA hospitals about this, a spokesperson sent me this statement. We are committed to workplace safety, from strengthening physical security and expanding our workforce violence prevention efforts to advocating for change through legislation. HCA told me it uses cameras, metal detectors, 24/7 security, and even off-duty officers at some facilities. Do you see the problem getting better?
I'm worried about the skyrocketing rates of mental illness and how that is surfacing within our hospital setting.
Nurses are leaving the field in droves.
Attorney Karen Terry says hospitals can and should do more to increase security. She represents the family of Leilama Lal, who was attacked in February. Since then, Terry has heard from hundreds of nurses, doctors, and staffers from hospitals all over the country.
And they all tell me the same thing. And it's a repeated pattern in practice that the hospitals and their chains are putting profits over the safety of their own employees. And people are tired of it.
And even back in 2001, we were trying to get more staff.
Bhima Ramdas left his job in 2010 after he says 2 patients attacked him. He's now an organizer for the local nurses union. He believes increasing staffing levels would reduce assaults.
If a patient's starting escalating, acting out, the more staff you see, they have a tendency of calming down.
How would you like to go to work every day knowing this can happen to you?
Linda Stewart says more of her former colleagues are counting the days until they can retire. Some are discouraging people from a career in healthcare. Lilama Lal's daughter says while her mother recovers, hospitals have work to do.
There's going to be more people and more healthcare workers that get injured if things don't change. I think that we really need to push for, stricter policies around, protections of healthcare workers.
Lilama Lal's attorney, Karen Terry, tells me she's determined to figure out what went wrong. In the meantime, 2 U.S. senators have proposed new legislation called Save Our Healthcare Workers Act. It would make an assault on a healthcare worker a federal crime, punishable by up to 10 years in prison. HCA hospitals and other healthcare systems support these added protections.